Welcome to One Vax, Two Lives. This is our robust conversation about COVID-19 vaccination in pregnancy. And we have our esteemed panel here who I would like to introduce themselves and will join the discussion as we answer these pivotal questions that affect your lives today. Dr. Cynthia Gyamfi, please introduce yourself.
Hi, I'm Dr. Cynthia Gyamfi. I'm a professor with tenure and the chair of the Department of Obstetrics, Gynecology, and Reproductive Sciences at UC San Diego Health. I also spent some time on the ACOG COVID Task Force and the SMFM COVID Task Force.
Thank you, Dr. Gyamfi. And Dr. Adams Waldorf, can you please introduce yourself?
Hi, my name is Dr. Kristina Adams Waldorf. I'm a professor at the University of Washington in obstetrics and gynecology, and I've studied infectious diseases, vaccines, and therapeutics in pregnancy for almost 20 years. And I'm one of the founders of One Vax Two Lives, which is a social media campaign to help to spread accurate information about COVID-19 vaccination in pregnancy and to dispel myths. And we're really proud to co-host this seminar with Black Health today.
Thank you, Dr. Adams Waldorf. And Dr. Kolina Koltai, please introduce yourself.
Hi everyone, my name is Kolina Koltai. I am a postdoctoral fellow at the University of Washington in the Center for an Informed Public. And my research area has been studying the anti-vaccination movement, vaccine decision-making, particularly on social media. So I've been studying that since about 2015, well before the pandemic.
Well, thank you everyone for joining us. And today I'm so happy to present One Vax, Two Lives, addressing COVID-19 misinformation. The COVID-19 pandemic has had a significant impact on pregnancy, pregnant individuals, and as a whole, birth outcomes. Today, we will explore how the COVID-19 vaccination has helped change the trajectory of the virus and thus the prognosis of COVID-19 on pregnancy, neonatal outcomes, and newborns. Also, we want to bring forth clarity and understanding between the COVID-19 vaccination with pregnancy, breastfeeding and lactation, and also fertility. COVID-19 is a severe acute respiratory syndrome that can present with mild, moderate, or severe symptoms. While mild symptoms such as fever, malaise, and cough may not require hospitalization, severe symptoms of dyspnea, hypoxemia, the need for oxygenation, or ventilation support may require hospitalization and possibly ICU admission. Pregnancy and recent pregnant patients with COVID-19 are at an increased risk of severe illness than their non-pregnant peers. This severity of illness includes hospitalization, ICU admission, mechanical ventilation, or ventilation support such as ECMO, and possibly death. Based on the recent CDC data collected between 2020 and February 7th, 2022, there has been over 171,000 total cases of COVID-19 in pregnancy. Of those 171,000 cases, there has been over 29,000 hospitalizations during pregnancy and 273 deaths. So let's explore the impact of COVID-19 vaccination and answer questions that affect pregnancy, breastfeeding, and future fertility with this esteemed panelist of experts. So before we get started, just a quick friendly reminder, we would like you to also remember to complete your pre and post evaluation survey. So let's get started. So we're going to start first with Dr. Kolina Koltai. Now, I've heard a lot of negative things about the COVID-19 vaccination, and it's hard to know what to believe. How do we find trusted sources?
That is a great question and something that I get asked all the time. I would say if you're attending this panel, that's already a great start. And part of that is because the way that we decided what to trust and not what to trust is really difficult right now because it seems very overwhelming. There's conflicting things. You're not even sure which expert is the right expert. So one thing that I like try to recommend to everyone is like, often look at the sources, right? So a lot of the people here on the planet, everyone here is at a university, which adds to our credibility. We have expertise. We've been studying our various topics of expertise for many, many years, and that adds to our credibility. But online, you're like, how can you look at all that up? I would say one of the best tools is just looking at what multiple people are saying. So not just looking at just one source, but looking to say how like multiple like media sources, how are multiple scientists or doctors are talking about the topic. So if you're like, I'm unsure about, say, the risk of, getting a booster while you're pregnant or getting your first vaccine, look to see what the resources are available at the time, and like, are there agreements or are there disagreements? But also one of the very first easy steps, if that seems a little too overwhelming, is actually just reaching out to your own healthcare provider. So talk to your gynecologist, talk to your pediatrician, even talk to your family doctor. And even if you have multiple doctors, ask them what they all say. And I think that's a really great way to start just trying to tease out something when we're in this like information overload where it's so hard to tell. And even if you hear like, oh, my friend said this, or I had a colleague that said that, that's really hard. So that we often want to put a lot of trust in what our like friends and family say, but it's so critical right now to really also emphasize what our healthcare professionals say.
Thank you so much, Dr. Koltai. I just want to remind our audience that we do have Spanish translation on our Spanish channel in the webinar. So please, we want you to join this conversation and ask the questions that you need. And remember, we do have translation in Spanish. So thank you so much, Dr. Koltai. So now I want to just take a look at a few, like the safety of COVID-19 vaccination and pregnancy. Is it safe? This is a lot of the concern that our patients have and that people have. Pregnancy is a very fearful time. It's the birth, it's actually having a new life inside of you, but also there is some anxiety and of happening during a pandemic. So Dr. Gyamfi, can you please tell us, is the COVID vaccine safe in pregnancy, and how does it affect the fetus in utero?
So it's a great question, Dr. St. John. I have to say that it's we now have so much more data than we did in the beginning of the pandemic, and certainly in the first days of the vaccine. And the vaccine has been proven to be safe. Initially, when it first came out, as many of you know, pregnant women were excluded from the clinical trials. And so it was very challenging for us to make recommendations. There were animal data that had to be presented to the FDA in pregnancy. And so that was very reassuring. And of the over 70,000 people that were included in the clinical trials, a handful of them, something just over 30, became pregnant. And so really we based our recommendations off of that. And we looked at the risk benefits ratio. And certainly the risks of getting COVID infection were much higher than we thought the risk to the fetus. What we have now are robust data that show safety in pregnancy, both with no effect on the miscarriage rate, no birth defects, and just safety overall. In terms of the vaccine itself to the fetus, the vaccine is in a vector that's an mRNA. And so as the vector goes into your body, it gets degraded in a couple of days. And so you don't actually get the virus. What you get is something that mimics the virus and convinces your body that you've seen it, so that you create antibodies, so that you're protected. So for all of those reasons, both we first theoretically thought that it was safe, but now we have data to show that it's safe in tens of thousands of pregnant women.
Thank you, Dr. Gyamfi. Dr. Adams Waldorf, can you kind of add, your thoughts to that, especially given your background?
Yeah, I would just echo what Dr. Gyamfi-Bannerman said. We have so much data now in thousands and thousands of women. This is not just one study or a few studies, it's many studies. There's probably not a week that I don't see a few more studies coming out that support the same kind of conclusions that we've had all along. There's no increase in birth defects. There's no increase in miscarriages or stillbirths. The pregnancy outcomes look identical, but of course, a little bit better if you didn't get COVID-19, which makes pregnancy outcomes much worse. So all of those things are very reassuring. What I've seen lately has been more and more reassuring data about the effects on fertility and on women who are currently going through in vitro fertilization. So just overall, everything that we've seen confirms and continues to confirm the safety of the COVID-19 vaccination. the safety on the fetus, and even passing those really critical antibodies to the fetus so the fetus has some protection once born.
Thank you so much. And so as we talk about, breastfeeding and passive immunity, right? A lot of times our patients are concerned with, breastfeeding. Can they breastfeed? And how does the vaccine, how does that change the immunity for the newborn? And so there's a lot of data about that right now in terms of how those antibodies transfer to our newborns and how long that actually lasts. So Dr. Gyamfi, can you talk to us a little bit about that?
Yeah, so I think most effectively, the vaccination during pregnancy will give antibodies to the newborn. But there's also some data to suggest that if you breastfeed and get vaccinated while you breastfeed, that you will still be able to pass antibodies onto the newborn. Kind of our best estimates now are that those antibodies last for about 6 months. But ideally, I think most efficiently, it's given through the cord blood if you were vaccinated during pregnancy. But really important to remember that if for whatever reason you didn't get vaccinated then, that you can still get vaccinated in the postpartum period while you're breastfeeding, and you can give some protection to your baby.
Yeah. So Dr. Koltai, does anyone else want to add anything about breastfeeding? Because I think these are very, very important items that we have to remember, is that this is safe and it's the best thing for our babies and our newborns, and that also vaccination can occur in the postpartum period. So as we kind of leap over to saying, what is the best timing? When is the best time to get vaccinated? So we know now that anytime, you can get vaccinated anytime during any trimester of the pregnancy, but we know the earlier that you get vaccinated, right? We know that more newborns and our fetuses will have increased antibodies. And again, this latest data telling us that these newborns may have antibodies up till 6 months. This is tremendous. So this is very hopeful for our patients and for everyone else. So now let's just ask these two questions. Here's a question from one of our audience. I was sick with COVID in January and I'm immune. Why should I get vaccinated now? Dr. Waldorf, would you take that on?
Sure. What exactly is immune is getting more and more complicated as these years go on, because people have had different vaccinations at different times. They may have become sick with COVID-19 at different times. What we know, just to make it really simple, is that if you've had the disease, your natural immunity is nowhere near as good as the vaccine immunity. Both natural immunity and vaccine immunity can fade over time, but vaccine immunity will always win over natural immunity, because that's how the vaccine was designed, to make the body produce the best antibody response that it possibly can. But as they both tend to wane over time, with vaccines, it's very normal to need to get a booster, which is of course recommended. And the times on that really depend on which vaccine you got in the beginning and so forth. But we feel that everyone needs to get a booster, even pregnant women that are vaccinated. So let's say that the pregnant woman has gotten Omicron, or that's the COVID-19 variant, in January, when lots of us became sick. So why should she get vaccinated now? And I would say because COVID-19, although we might be done with COVID-19 and we feel like we're done with masking, COVID-19 is not done with us. And I'll talk about that a little bit more as we keep going. And I would say that your vaccine is your best protection throughout the entire course of your pregnancy, to not become hospitalized and to become really sick. And COVID-19 is just not going away. So I would say, yes, absolutely, you should get vaccinated now and get your booster when you're eligible.
Okay, so thank you, because that was another question that we had from the audience, is if I'm pregnant and I do get COVID, so that's that natural COVID, should I, when I'm eligible, get the vaccination? And Dr. Waldorf, you say?
I would say absolutely. As we kind of go along, when we start looking forward to see what the COVID-19 variant landscape might look like in the next 6 months, I think that you will see that COVID-19 is just not quite done with us yet.
Thank you so much. Now, Dr. Gyamfi, we have another question. If a pregnant patient gets, can a pregnant patient get COVID-19 after being vaccinated? Is that possible?
Unfortunately, as Dr. Adams Waldorf alluded to, the Omicron variant taught us a lot of things. And one of those was that even after vaccination, you can get the COVID infection. The differences that we saw were pretty clear in that those who were vaccinated had a milder course than those who were not vaccinated. So yes, it's absolutely possible. In fact, no vaccine is perfect, and there are some who will get sick after vaccination. And the immunity does wane over time, which is what we're learning. But it's so yes, you can get infected after getting vaccinated, but the course was much more mild than if you weren't vaccinated.
Thank you. So knowing that COVID-19 can have a severity of illness in pregnant people, what our audience wants to know is, should they be concerned given that there are kind of lightened mask mandates happening right now? Should they wear masks, even if they're vaccinated or even if they've had COVID and they're pregnant? What do you say about masks coming off?
Can I take that question?
Sure.
Yeah, okay. I'd like to kind of bundle that question in to something a little bit farther forward when we're looking at the variants and looking forward into the future. I, like many other kind of public health scientists, think it's a little premature to have the masks coming off. I certainly understand people that are tired of wearing a mask. I've worn a mask my entire life as a physician in the hospital, but I understand I'm also tired of wearing a mask. But when you're pregnant and immunocompromised, I would say give it another month to 6 weeks. Let's see how things look. I would be on the more cautious side to take off your mask at the moment. And I'll try to convince you of why that is in just a moment.
So again, for pregnant women who are also immunocompromised, does the additional booster, is the additional booster recommended by the CDC?
I'll go ahead and take that if I can find the right screen to share. So it's a really very narrow group that the CDC recommends to get this kind of additional booster. And some of those people in those very kind of specific groups can actually be pregnant. So it is possible for some pregnant women to be diagnosed with cancer and to be receiving chemotherapy during their pregnancy. That does happen sometimes. So that kind of individual would be eligible. If a pregnant woman has received an organ transplant in the past, and there are pregnant women who have received a kidney transplant or even a heart transplant, and they're taking medicines to suppress their immune system, they're also eligible. Someone who's received a stem cell transplant in the last 2 years, has a very specific type of immunodeficiency, has advanced or untreated HIV infection. That's a little bit more rare in pregnancy. Usually pregnant women are treated, or has active treatment with high-dose corticosteroids. And that is maybe a little bit more common with certain types of autoimmune disease. So certainly there are some pregnant women that would meet those criteria, and they would be eligible for that additional booster that the CDC is talking about.
So thank you. We've been basically talking about COVID vaccine safety. And so I want to just also pivot, because we've been talking about it in pregnancy, but what about persons of reproductive age who are thinking about getting pregnant, who are fearful of any disturbances in their menstruation or any kind of possibility that their future fertility can be compromised? What would you say to those persons who are thinking about, conceiving in the future, who are not pregnant now? How would the COVID vaccine affect their future possibilities of fertility? Dr. Gyamfi?
So there were 2 very nice studies that were published early on in the pandemic to show the safety of the COVID vaccine during reproduction. So one was in a fertility clinic where they looked at women who were undergoing IVF for whatever reason, and they looked at their outcomes by COVID vaccination status. And in a very large cohort of women who were undergoing IVF procedures, there was no difference in their rates of fertility success. So that was on the female side. On the male side, there was also another nice study where they looked at men of reproductive age, and they did semen analyses counts. And then a week later, these men went to get vaccinated, and then they repeated those counts in a couple of months from vaccination. And again, no differences. So those were some of the early data that we have seen. Now we have robust data looking at miscarriage rates, both for people who are vaccinated compared to unvaccinated folks or historic controls, but also they looked at a group of women. Unfortunately, miscarriage is relatively common. So they looked at a group of women who had miscarriages and compared COVID vaccination status in that group, and there were no differences. So there's now ample and robust data to show that there's no effect on fertility, both on the male side and the female side.
And Dr. Adams Waldorf, would you like to add, because our patients of reproductive age have very significant concerns. And again, this is a time of uncertainty, and they want to conceive in the future. So they want to be assured that the vaccination will not compromise their ability to have children in the future. What would you add?
I would say that one of the most, detrimental and really kind of terrible things that the that anti-vaccination forces of misinformation has done is to try to couple COVID-19 vaccination to a woman's fertility. There's zero evidence that that has ever been true. There's no reason to think that. We have lots of studies that show that women's fertility is not affected at all by COVID-19 vaccination. And I just find that possibly the worst thing that has come out of anti-vax vaccination media related to women's health. And I just wanted to ask Dr. Koltai about kind of, this kind of myth about COVID-19 vaccination affecting fertility and what she has seen in her anti-vax studies.
Yeah, as Dr. Waldorf has very astutely pointed out, that this is a rather insidious component of like vaccine misinformation. And honestly, it's a bit of a trope. I think you cannot point out a single vaccine that's been created that hasn't been linked to women's fertility. And if you link it to every single vaccine, and we've seen zero evidence, and there's vaccines that have been on the market for much longer who have had even much more robust, and as we've already discussed here today, there's so much research has happened around COVID vaccine. If you think about it, even relationship to childhood vaccines, the flu vaccine, HPV vaccine, not a single vaccine that is recommended by doctors impacts your fertility. And the same is true when it comes to the COVID vaccine. It is a trope that is very scary, that gets a lot of shares online. And no one wants their fertility harmed, men or women or anyone on the spectrum. And we just need to reiterate that no, the vaccine does not impact it. And in fact, it could be so helpful to providing not only the safety for yourself, but the safety of your child.
If I can just say one more item though, we've been talking about women's fertility, but if we talk about men's fertility after they've become quite sick with COVID-19, any major illness does decrease sperm counts, at least in the short term. And that's true also of the COVID-19 disease. When you become sick with COVID-19 for men, we have seen that their sperm count does drop. So becoming vaccinated and being protected from severe disease is a way to kind of protect those sperm counts, at least in the short term, if a man is trying to conceive with his partner. The other thing that we have seen, and we don't really know how common this is, but there is small vessel disease that can happen with COVID-19, and some men have lost the ability to have an erection. Again, we don't really have a good sense of how often that happens, and we think it's probably rare, but that's another really good reason for men to become vaccinated for COVID-19 and to avoid having a really severe disease.
Wow, this is really, really helpful because what we're allowing our audience to see is that our vaccination doesn't only affect and protect our pregnant women and our newborns, but also our men as well. Now, I just wanted to make sure we really touch on this because again, this is another a tad bit of misinformation is the effect of the vaccination on menstruation. So Dr. Koltai, can you just add something about how there isn't an effect on menstruation, please?
Yeah, this is again another trope that we've seen also applied to other vaccines in the past. That is a trope now. And in fact, if anything, I would like to highlight that the COVID-19 disease actually has probably greater impact on menstruation than the COVID-19 vaccine. And so there is, and I believe everyone else could talk a little bit more about the scientific components of like why there could be some disruptions in a menstrual cycle. But if you do experience any disruptions in a menstrual cycle, it does not mean that your fertility is impacted. So again, it is safe to get vaccinated, even if you're trying to get pregnant. If you get vaccinated and you feel like you have disruptions within your menstruation cycle, it often returns back to normal and it does not impact your fertility.
Okay, so I think we should also talk about, so as we talk about COVID vaccine, we have to talk about, as we talk about its confidence, we have to talk about COVID vaccine hesitancy. And often there are marginalized, unrepresented communities. There's Black, Indigenous people of color, communities who really, really have apprehension and mistrust about the vaccination. So what are the strategies that we may employ so that we can make sure that we engage those communities and support them and provide the education that they so rightly deserve? Dr. Koltai, can you add?
Yeah, I'm going to give advice for both providers, if there's any providers on the call, and for patients as well. So as provider, I would say make sure to continuously be aware of any particular biases or any sort of potential like any biases that you have, and making sure you're creating a safe space and environment for your patients to bring concerns that they have. Please listen to the concerns of your patients and realize that it's maybe just not a negative experience that you may give them, but another provider also may have given them. So it's really important for providers to continue to build trusted relationships with your patients, and being transparent and open and have that conversation is absolutely necessary. And for patients who are feeling this, I can say that even as a person of color myself, I've had negative experiences with healthcare providers. Some have been really great and some haven't. And I know that like can impact my own trust and like whether or not I trust that person. And what the bits of advice I gave is like, one, it is okay to always get a second opinion if you feel like you're having a healthcare provider that is dismissing your concerns. And it's also really important to be an advocate for yourself, right? It is important to make sure that you know your body best, right? So if you're having a particular symptom and you want to be able to talk to your doctor about that and continue to build the trust, and if you're finding a doctor that's dismissing you consistently, then it might be time to find a doctor that does listen to you. Just because the experience of one doctor or a few bad doctors does not mean the entire field is out is malicious. There are so many wonderful healthcare providers that want to listen to you and want to help you. So it's really important to continue to build that trust on both ends, while still also making sure you have your health in line. And now and I understand there are so many terrible stories that we have heard about people's concerns are being unheard. And again, your advocacy, finding the right healthcare provider that's going to listen to you, I think is always going to be the best option. And I know that's hard. That's like really limited advice for a really large, complicated problem that is happening in society. But it is the most I could talk to you about now in like 30 seconds.
Yeah. And I think that one of the practices that I have employed is making sure that we amplify the patient's voice, making sure that they're allowed to give their patient story, validating their experience. And then also, sometimes it works when you share your own personal reflection and talk about your own family. Or, I have many people in my family who are hesitant to get vaccinated. And what I try to do is support them, provide them with the information. And again, this is a conversation that has to be on repeat. It may not be solved in one, again, I've gotten most of my family vaccinated, but again, I understand that it's a conversation that has to reoccur. And I think as we think about community strategies, we have to also engage community partnerships, community leaders. We have to look at faith-based organizations, but I think also we can lead by the example and letting them know that we have gotten vaccinated. And so these are some of the strategies that I have tried to employ. Dr. Gyamfi or Dr. Waldorf, do you want to add to that?
Yeah, I mean, I would second what you're saying. I think it's very important not only to validate the patient's concerns, but also to speak to what's happening in our own families. Because for most of us, it's a conversation with everyone, just letting them know, what the data show and what we've done, and getting vaccinated myself and my husband, and then as soon as my kids were eligible, they got vaccinated. So those are our stories, and I think that when you listen with your heart and you put a face to this pandemic, then it's not only advice, it's what you're doing in your own family. I think that makes a big difference.
And Dr. Waldorf, do you want to add anything?
I think that Dr. Gyamfi-Bannerman said it just really beautifully. I just wanted to add that just having the courage to tell people that you are vaccinated. For some people that, and in some places in the country, that certainly takes courage, but it's really one person at a time who says, I got vaccinated. I'm really happy that I'm going to be much more protected from COVID-19. I researched the data, and this is what I kind of came to. It's kind of those conversations, again, at the local level, with people talking with their friends and their family and in their churches and in their communities and at the baseball game. It's that kind of level of discussion, and that will eventually lead us to have higher vaccination rates in the country.
Yeah.
And you might find that it might take more than one discussion. I still personally have family members who are not vaccinated. And recently I had a friend of mine who I've known for years, who knows the work that I do, only recently got his very first vaccine. And so it's still possible. Just because people are still hesitant today, and people in your network, doesn't mean they're never going to get vaccinated. I think it is a consistent conversation that has to happen time and time again, and don't give up.
Yeah, I think those are powerful words, and I think also we can always lead by example and just make sure that we listen to our patients. Listening and understanding and respectful communication is so key, especially when there is a difference of opinion. But again, you can't give up, and you have to keep that conversation going. So what would you say is one of the most effective ways of educating people about the COVID vaccine? Dr. Koltai?
Yeah, particularly if someone's a little vaccine hesitant and they're not sure, I just have them talk with me about what are they feeling? Why do they have hesitation? I don't come at it from a point of attack. You always want to listen to people's concerns. And so even if I might disagree with them initially, I want to let's unpack it. Let's talk about it. And oftentimes if it's something that I think that they might have been misinformed about something, I'm just like, well, let's talk about the source. And I try to help people work through debunking some of their own content, give people their own agency to help kind of navigate online spaces to figure out like maybe what is more trustworthy, what is less trustworthy. And also all without saying that you are wrong or that is incorrect. I say like, well, here's some other things that we can see. So it's about making sure you're empowering people to have their own agency to figure out what is more truthful than or more credible sources than others. And while never saying that you're wrong, you're incorrect, you're stupid. You never want to have that part in that conversation.
Very, very great advice. All right, as we kind of move as to saying, what are we looking forward to? I'm here in New York, and the mask mandates and the vaccination mandates are kind of going away. And the COVID-19 infections have fallen to the lowest levels since last November. Do we still need to worry about COVID-19, Dr. Adams Waldorf?
Yeah, well, we've kind of been at this point many times before. And I listened to a lecture recently by one of the top scientists who studies how COVID-19 mutates and changes its form. And he said that he predicted that the next variant after Delta would be kind of a descendant of Delta, something that was really close to Delta. So when Omicron came, which is very different from Delta, it was like out of the blue. It was like nothing that they had expected. And that has happened to us so many times with COVID-19, where we have underestimated the ability of this virus to keep changing and to keep taking new forms. Currently, when we think about Omicron, the most recent variant, maybe we think of it as kind of one virus or one variant, but in fact, there are 4 subvariants of Omicron that the World Health Organization and public health leaders are following. And of those, I'm just going to mention one of the 4, which is has the nickname of BA2. So if you're on Twitter and you want to just put in a hashtag BA2, you're going to find some of this information I'll be talking about this morning, because nothing comes as fast as Twitter. So I just looked this up this morning from one of our public health epidemiology leaders. And so this is from New York. So if we go into early February, this BA2 variant, which spreads about 50% faster than the old Omicron variant. So it's incredibly contagious. We don't think it makes people sicker. It's just much more contagious. So in early February, about 2.5% of all of the COVID-19 infections were from BA2. In late February, it's now almost 8%, which means that it's gaining. So as the traditional Omicron variant is really coming down, this variant is gaining. And we see the same thing if we look at the states of New York, New Jersey, Virgin Islands, and Puerto Rico, is that they're currently now, their infections, about 12% are BA2. And so I'm just going to show you one graph to kind of give you a sense of what we're talking about. So if blue was the Delta variant, which just hit us really hard in July and August and September and October, everything was Delta way back then. And then that one started to go away when we started to get the Omicron. Here are some of the different subvariants of Omicron. So we've got the BA1, 2 subvariants that came, and in December and January and February, lots of people got sick. And what we're seeing now is this BA2 subvariant of Omicron that is just kind of stealthily starting to come up. And so even as these other variant is going away and our other infections are going away, this green line is something to watch. So what we have to kind of consider is, how immune are we actually? Some people are unvaccinated. Some people have had a vaccine series, but no booster. Some people have been vaccinated and boosted. Some people have had the disease once, but maybe it was a year ago, or they've had Omicron recently, but nothing else. So it's super complicated as to how immune people actually are. And what I would say is that the chance that you will be exposed to the virus that causes COVID-19 is not going to go away. The variants that we're exposed to now are even more infectious than Omicron, which was many times more infectious than the earlier varieties. When you're immunocompromised, I would suggest absolutely to have your primary vaccine series and that booster, even if you've been sick in the past and had the actual disease. And that I would expect that almost all of us will at some point here be exposed to this new variant. We know that the vaccine series and then the booster dose, and 2 weeks after that, about 70% of people are completely immune to Omicron, including probably this new variant. And about 30% of people might get a breakthrough infection, but we expect it to be mild. So I would say things are not going away. I think it's a little bit premature to be taking off your mask if you're immunocompromised, and that would include pregnant people. If you've been vaccinated, boosted, you've had Omicron, you're not immunocompromised, then I think, living a normal life and following the public health recommendations for mask mandates seems totally fine for me. But people that are immunocompromised might want to consider this and be a little bit more careful and wait to hear what we get in the news cycle in the next month. It's been dominated by the invasion of Ukraine, and everything about Omicron has kind of gone away. But in the next month, I'd be very curious to see what we're dealing with this new variant. Oh, Dr. Saint Jean, I don't hear you.
Sorry about that. Thank you for that explanation. And given that concern for this possible next variant, we have a question in the chat. Says, do you think the mask mandate should be lifted?
I think that there is no political will left to try to keep these mask mandates in place. So it's almost like at this point, vaccines have been available. There's been lots of information out there, and the politicians have thrown up their hands and said, this is what we can do right now. So I think it's like almost everything else, it's almost every person for themselves. Ideally, it would be a community action to try to deal with a communicable disease and to be vaccinated. But I think taking good care of yourself, continuing to wear a mask if you're pregnant would be the right thing to do, or if you're actively undergoing cancer therapy, and being up on the news and what's happening with the latest variants and public health recommendations.
So just one last question I pose to the panel. So say one of the people that are watching us today, say they're not vaccinated. Should they get vaccinated now? And how do they know if the vaccine will help them with the next COVID-19 variant?
I can start. So I think one take home from this is that absolutely you should get vaccinated. As Dr. Adams Waldorf has said, the virus isn't going away. The change in the strategy is multiple fold, but one of the reasons for a change in strategy is that it's really gone from first as an epidemic to a pandemic, and now it's endemic. Looking at strategies for an endemic virus, now we're in the realm of looking something that's more similar to flu, where it's not going to leave us. So the flu virus never left us, but we have different strategies in terms of treatment and in terms of approach. But it's really important for folks to remember that it hasn't gone away. And so the things that are changing in terms of taking masks off and all of that doesn't mean that COVID has gotten quote unquote better. We're just looking at different ways to strategize. In terms of vaccination, what we've seen with all of the variants is that while you still can get COVID while you're vaccinated, the disease has been milder. And that's very important, particularly when you're pregnant, because we know, as Dr. St. John said earlier, that pregnant women get a worse infection with COVID than if you were a woman who's not pregnant. So really important to make sure that you get vaccinated, because if you ultimately do get COVID, so far with all of the variants, you'll have a milder course. We don't know if the vaccine is going to be effective against the next variant or the next variant, but what we do know is that so far it's been proven to help decrease the likelihood of severe disease or hospitalization.
Great. I just want to make sure we just address this question in the chat. And it says, if pregnant and already boosted 5 months ago, should a fourth shot be given, and at what gestation?
And I'll take that question. And I would say that we have to follow the CDC guidelines on that. And so it's really very narrow groups that would be eligible for that fourth booster that we think that it might be helpful for. And this is people that have active cancer, undergoing chemotherapy, specific immune deficiency conditions. Pregnancy is not one of those, on high dose steroids and so forth. And those can be found on the CDC website. If you search immunocompromised COVID-19 vaccine booster, something like that, you'll find that list that I showed earlier. So I would not get another booster now. Your immune system has been trained a couple of times to recognize the virus, and it has been really helpful, I think, to kind of get people more immune at this point.
I just want to give each of our panelists an opportunity to give us some of their final and closing thoughts in regards to our One Vax, Two Lives presentation. And I'd like to start with you, Dr. Adams Waldorf.
I would just say that if you're pregnant right now, you're in a much better position in terms of your access to vaccination, your access to good information than women that were pregnant in the winter of 2019 and 2020, coming into early 2020 when we really didn't know anything, and lots of healthcare workers were getting vaccinated that were pregnant because we were so fearful of the disease. And, at this point, the studies again and again are confirming the safety of the COVID-19 vaccine in pregnancy. And if you go to the chat, you will find our website, One Vax Two Lives, where we have summarized all of the really important studies, and you can find links to all those studies for frequently asked questions.
Dr. Gyamfi, do you want to give us your final thoughts?
Yes, thank you. First of all, thanks for inviting me to participate here. I think this has been fantastic. It's very timely as well because we are just a few days from the 2-year mark where this was declared a global pandemic. And I think, as Dr. Adams Waldorf said, we are in such a better place now than we were. We now have treatments that are effective. We know a lot more about how the virus is transmitted, and so we can target that in ways that we couldn't 2 years ago. And I think we have plans to keep people safe. And so if you're considering pregnancy, absolutely, there's no better time than the present because we never know what the future might hold. But make sure you're vaccinated. You can vaccinate yourself now before pregnancy or during pregnancy. During pregnancy, optimally, you will help your newborn to develop antibodies. And if you haven't been boosted, get your booster. The second booster, as we said, is still for a very small limited group, but that first booster should be for everyone who is pregnant or not pregnant. And there's definitely hope. We've had these types of viruses before. We've been able to manage them, and I think we're getting towards the other side where we have other ways to address this virus. And so hopefully we will see what our new normal will be moving forward.
Thank you, Dr. Gyamfi. And Dr. Koltai, final thoughts?
Yeah, vaccine misinformation is never going away. As much as I would like to, I would wish to go and study something else, but it's not going to go away anytime soon. So I recommend to everyone listening on the call and anyone who might be watching this later to remember to always have a little bit of reservation before you decide to share something online or even within your networks. In times of crisis, and we're in this long extended periods of crisis, is that misinformation is spread so easily, especially when something creates an emotional response in us, right? So that's why sometimes misinformation around pregnancy and fertility can spread so virally online, because you hear something saying the vaccine is dangerous or it causes infertility. It creates a shock. It's an emotional response. So if you find yourself having that emotional response to some bits of misinformation that you're hearing, remember to take a moment, pause. Sometimes the debunk, sometimes the correct information may take a little while. It's really easy to create misinformation. It takes a lot more time and effort for all the studies, all the research, all the accurate and trustful, credible information. That stuff takes time. Misinformation can be created in an instant. So remember to always stay vigilant. It's not only the health of you and your family and your kids, but also you think about your information health as well. So, and this is not just applicable to vaccines, but any other misinformation you may encounter.
Thank you. We must understand the impact of COVID-19 has had on our pregnant patients, and this includes increased maternal mental health issues, increased domestic violence, decreased prenatal care visits, and increased childcare demands to affect change. It is only through understanding that we can be intentional in our actions to problem solve and develop patient-centered solutions. COVID vaccine confidence can be achieved when we prioritize the patient. Acknowledgement of misinformation is key, but because we must start with community engagement and understanding that we will aid in fortifying bonds of trust, amplifying the patient's voice, normalizing shared decision-making, and importantly, providing education that defies the social determinants of health, provides resources, and magnifies respect and culturally congruent communication. Thank you for your time today and your attention. But furthermore, we want to thank the National Black Leadership Commission on Health and One Vax, Two Lives for their sponsorship of this webinar and providing this platform for this important conversation. Thank you for our panelists. We want to remind our audience to please complete the post survey that's in the chat. And thank you for allowing us into your homes today to talk about this important topic. One Vax, Two Lives. Thank you. I just want to open the floor. Is there any questions that we didn't go over or that we should address? Okay.
There's a question that says, what are the current treatment available for pregnant women?
I think we have a few more moments. So Dr. Gyamfi, would you like to talk about the current treatment for COVID-19 in pregnancy for pregnant people?
Yeah, it depends on the severity, but pregnant women are eligible for monoclonal antibody therapy, which can be done as an outpatient. And on the inpatient side, we give remdesivir and steroid. And so we found that these treatments are both effective and safe in pregnancy as well.
Thank you. I just want to make sure we did not miss out on any other questions. I think we addressed everything. Well, again, I want to thank everyone for joining us today. I want to thank the National Black Leadership Commission and also One Vax, Two Lives for allowing us this opportunity to discuss this very important topic of COVID-19 vaccination in pregnancy and also defying the misinformation that is out there so that we can provide education and support to our patients, our providers, our colleagues. And again, we want to make sure that patients understand that vaccination is always one that is going to help not only the patient, the newborn, but also the male as well. So we want to educate and encourage our patients to be vaccinated. Thank you.